as Democrats seethe over Tom Price pick. Health lobbyists see opportunity. President-elect Donald Trump's pick to lead the federal government's health agency has resulted in outrage from Democrats and reproductive rights advocates, but many members of the healthcare industry are hopeful about the prospect of lobbying their causes to a familiar face who not only knows Washington but hails from the medical field. Trump's appointment of Rep. Tom Price, a former orthopedic surgeon, to be Secretary of the Department of Health and Human Services signals the president-elect intends to follow through on his promise to repeal President Barack Obama's healthcare law. Price has been a vocal critic of the law and introduced a replacement plan to the Affordable Care Act called the Empowering Patients First Act. Critics say his plan would leave millions without health insurance and allow only the youngest, healthiest Americans to benefit. They also have slammed his opposition to the contraceptive mandate in Obamacare and note that he has voted to defund Planned Parenthood. The New York Times editorial board called the Price choice radical and said it indicated that Trump would systematically weaken or demolish the nation's healthcare safety net. Despite this, industry groups representing payers and providers, such as the American Medical Association, America's Health Insurance Plans, the Pharmaceutical Research and Manufacturers of America and others who also have been cheerleaders of Obamacare or of particular provisions, saw the appointment through a more positive lens. If Price is confirmed, he will be the first doctor to hold the role of health secretary in nearly 30 years. He will be in charge not only of implementing a replacement plan for Obamacare, but will be overseeing agencies that carry out food policy, medical research and public health. The agency affects a huge swath of the healthcare industry, says Thomas Buckmuller, professor of business economics and public policy at the University of Michigan's Ross School of Business. It's not just about the Affordable Care Act. It makes sense to stay on good terms to the extent that you can. Tim Yost, emeritus professor of law at Washington and Lee University, says some of the enthusiasm is centered on the fact that lobbyists are getting someone to lead the agency that they are familiar with. Price, 62, has been in Congress since 2005 and is chairman of the House Budget Committee. Agree with him or disagree with him, he is someone who has thought a lot about health policy and has a lot of understanding about how the healthcare system works. Yost says, several groups said they valued their history with Price and noted his willingness to listen and seek out their feedback. Price always wanted to hear from you, says Cliff Porter, Senior Vice President of Government Affairs at the American Healthcare Association, which represents nursing homes, and the National Center for Assisted Living. He respected providers and wanted to know their opinions in defining policy. Having that kind of guy at the helm is going to be helpful. Still, Porter acknowledges members of his industry would be concerned about any rescinding of Medicaid payments, as they make up the bulk of funding for their services. The group says it is waiting to see more details about what will happen to the program in the Republican alternative to Obamacare. Related data show Obamacare is working. Mary Greeley, president of the Healthcare Leadership Council, which represents a range of groups from insurance to drug companies, says she believes Price has given thoughtful consideration to possible health alternatives. I think there is a sense of, isn't this someone with hardcore beliefs? Yes. But is it someone you can't talk to and work with? Absolutely not, she says. I would put him in the very approachable category. He is willing to listen. I have seen him modify and incorporate ideas. They and other groups like the American Association of Orthopedic Surgeons say they also value his stance on tempering government regulations, which they say have been burdensome. Members of the healthcare industry understood that changes to Obamacare were ahead regardless of who won the presidential election. Though the law reduced the number of uninsured to a historic low, and a recent government study found more than nearly 13 million people report they have an easier time paying medical bills since the law passed. Both parties say fixes could be made. Chris Jacobs, founder and CEO of consulting firm Juniper Research Group, says there is opportunity for better healthcare coverage. "We shouldn't just focus on who has an insurance card," says Jacobs, who previously worked for the conservative Heritage Foundation. "That doesn't necessarily mean access to care." Reports have concluded that not enough young, healthy people enrolled in the exchanges, which allow most people who don't get insurance from an employer to buy coverage at a tax-subsidized price. The trend contributed to driving some insurers out of the market, increasing prices of individual policies and reducing the number of coverage options people can buy. With the election of Trump and the price pick, lobbyists have some clues about the type of replacement plan that could take shape and ways to influence any changes. Though Price can't change major provisions of the law without an act from Congress, his bill had a Senate companion. Many of its provisions were also included in an outline called Better Way, presented by House Speaker Paul Ryan, RWIS. His plan puts emphasis on health savings accounts and bases tax deductions towards private insurance on age rather than income, among other measures. This week, leaders in Congress have said repeal would include a transition of up to 3 years before a replacement plan goes into effect. Trump also said he would consider keeping some popular portions of the law, like continuing to cover people regardless of pre-existing conditions and allowing children to stay on parents' plans until age 26. With this rough framework, some groups already have provided recommendations to the new administration. The Association of American Medical Colleges, which called Price a strong choice, outlined policy priorities, including recommending against changing Medicaid to a block grant model, which Republicans have endorsed. The model sets a fixed price and proponents say it gives states more flexibility on how to spend funds, while opponents say it would decrease needed funding. The American Hospital Association, which called Price uniquely and impressively qualified to lead the agency, urged the administration to address escalating drug prices and to resist mergers of large health insurers. Among other proposals, the group also urged the administration not to repeal portions of Obamacare without a backup plan that would ensure people receive coverage. Some groups got blowback for their supportive statements about the appointment. The AMA, the country's largest doctor group, said it urged Congress to promptly consider and confirm Price, whom it strongly supports. The group pointed to his work in advancing patient choice and his efforts to reduce excessive regulatory burdens. This was met with backlash from individual doctors, including from the Clinician Action Network, which wrote an open letter to the association saying Price's policies threaten to harm our most vulnerable patients and limit their access to care. The American Medical Association later clarified its stance, saying their support shouldn't be taken as an endorsement of every policy position Price has held, noting they have disagreed with him on Obamacare's passage. A mainstay through the years has been Dr. Price's commitment to seek out and hear the concerns expressed by the AMA and other physician organizations, wrote Dr. Patrice Harris, board chairwoman for the group.